I have a question from Hugh. Can you talk about therapeutic outcomes? Okay, let's just, because this taps into finding a destination, doesn't it, a little bit, but let me just talk about this therapeutic outcomes. Okay, well, there are two ways you can reach a therapeutic outcome. They both result in the same change, but they happen in different ways. Okay. There's, on the one hand, there's change. Bang, changed. Smoker, non-smoker. Weight loss, that's not going to happen. Fat, thin, no, it's not going to work, right? So what's the other kind of change? It's improvement. But improvement, if continued, leads to change. Okay, so we need to decide what is the best therapy for our client? Change or improvement? Is improvement unrealistic? Well, not really, because you can do improvement in small steps over a period of a year, for example. It doesn't mean they come every week, they come every 3 months, but it's, you know, over time. What about change? Are there times when you can't do change? Of course there are, because what they're asking, the client is asking, is impossible given what the outcome needs to be and what has to happen between now and the achievement of that outcome. That change is not going to happen like that. Some people do have very unrealistic expectations. I've had people come to see me and say, just click your fingers and I want to be better. You do all the work for me. And I'm saying, well, let's work together on this. No, you just, I've seen it on television. I've seen it on television in that movie the other night on Netflix. All she did was click her fingers like that. That's it. And he was better. So change or improvement. So therapeutic outcomes. Hugh, this is what we talk about. Okay. Number two things that can happen in therapy. Why does the client want to be there? Do they want something to stop, or do they want something to start? Is there some goal that they want to achieve in life that they're not achieving? Well, if you're working in the field of sports, for example, that is very much the case. There's always stretching yourself, going beyond the limitations. So does your client want to stop something happening, or they want to start something happening? Often there'll be both, of course. So you have to look at how realistic it is to stop and how realistic it is to start. What's going to happen? How can you work on making something start if you haven't worked on stopping? What's preventing it starting? Okay, so think of that as well. Okay, so there you've got those two ways of looking at it here. Change, improvement, stopping something, starting something. You analyze what your client needs to best achieve the outcomes that they want for themselves. And that's the path that you take. Okay, thank you for that, Hugh.